What about Tysabri? Do people with MS taking Tysabri have to worry about coronavirus disease 2019? Does taking Tysabri increase their risk of infection? If you want to know the answer, don't turn away, because it starts right now. The next drug I'd like to discuss is Tysabri, or natalizumab. And in fact, this is a tough one. We're not exactly sure how taking Tysabri alters your risk profile for coronavirus. Here's the deal. Tysabri prevents circulating white blood cells to enter into the central compartment, so in the brain and spinal cord. The peripheral compartment is normal. Your immune system in the periphery in your bloodstream is normal, but your immune system is massively suppressed in your brain and spinal cord. So, if the coronavirus can easily enter into the brain, that's a big problem for people on Tysabri. If the coronavirus cannot easily enter into the brain, it's not such a big deal. And to speak plainly, I think today we're not exactly sure how neurotropic or how easy it is to enter the brain coronavirus is. We don't know. And so what do we do about that? Should we stop the Tysabri? No. Stopping Tysabri on your own is a really, really bad idea. And of course, we would never want to stop any medicine, particularly Tysabri, without talking to our provider. Please keep in mind that if you are to stop Tysabri, you have to have an exit strategy. You have to have a plan to transition to another drug so that you don't risk a rebound phenomenon. Lastly, where you live matters. So if you are someone treated with Tysabri in Italy, we might end up recommending to stop that therapy and transition to something else. Whereas if you were taking Tysabri in Columbus, Ohio, where I practice, I don't think we're going to be stopping your medicine. Let me go through 9 tips, things that you can do to mitigate risk of infection. Number 1, sanitize your hands, or wash your hands with soap and water. But if you use soap and water, you literally need to wash for 20 seconds. That's very important. You want to make sure that you're sanitizing or washing your hands before you eat, after you go to the bathroom, after you blow your nose, cough, or sneeze. And if your hands are visibly dirty, there's dirt on them, then you definitely want to use soap and water. Number 2 is to cover your mouth and nose when you cough or sneeze. Ideally, cough or sneeze into a tissue, throw the tissue in the trash can, and then sanitize your hands. Similarly, try to avoid touching your nose, mouth, and face. If you touch a surface that has virus and then you touch your nose, mouth, or face, you can introduce virus into your body. By simply not touching your face, you can decrease the risk. Number 4 is to stay home if you're sick. Don't trudge through and go to work where you can infect other people. And number 5, obviously, I want you to avoid sick contacts to decrease your risk of becoming infected. Number 6 is to disinfect surfaces that are commonly touched. And this is a good idea in your house. This is a good idea in your work. I had a viewer comment that it would be a good idea to desanitize your cane, and that's an excellent point. Number 7 is to stay fit and maintain a healthy lifestyle, because if you are fit, you're going to handle a viral insult much, much better. Number 8 is get your flu shot. People with MS benefit from getting a flu shot. Of course, you need to check with your provider to make sure that's safe for you. And as I talked about in my last video, wearing a mask, a regular mask that you buy at a pharmacy, does not decrease your risk, but washing your hands does. Thank you for learning about MS with me, Aaron Boster. If you haven't checked out my first coronavirus video, I'll throw a link up above so that you can check that out. YouTube Analytics thinks that you would love this video right here, so you might want to look at that one. And if you haven't yet subscribed to my channel, please consider doing so. Just click that circle with my face on it. Go ahead, click my face. Until my next video or my next live stream or the next time I see you in clinic, this is Aaron Boster saying take care.